the 2008 International AIDS Conference, brought to you by KaiserNetwork.org.
It has always been the role of the International AIDS Conference to challenge our governments and our leaders to meet their moral and political obligations. And it will happen again here in Mexico City, where we are demanding universal action now.
For the first time, fewer people are dying of AIDS, and for the first time, fewer people are becoming infected with HIV. For the first time, we have empirical evidence that our brilliant coalition can move mountains.
I call on all countries to live up to their commitments to enact or enforce legislation outlawing discrimination against people living with HIV and members of vulnerable groups.
In this region, where men who have sex with men continue to bear the brunt of the epidemic, that means challenging homophobia everywhere, in our society, in government policies, in healthcare settings, in our families, and yes, in our churches as well.
We should not accept that less than 10% of individuals at high risk for HIV, like sex workers, IDU, MSM, and prisoners in developing countries, are receiving appropriate prevention interventions. We should not accept that PMTCT, a proven effective preventive technology, is not the highest of global and national priorities to reduce HIV transmission to children to below 2%. We should not accept that we cannot provide HIV testing routinely to all who need it.
She's received decent medical care, loving care, decent nutrition, and treatment. That's the same child.
At age 18, we are considered out by governments for being sent to battle to protect our country. But when it comes to protecting ourselves, the funding and support for our right to access evidence-based and comprehensive services that also promote condom use and contraceptives as a means of safe sex is often denied, especially to those most at risk.
In all cases in which national HIV epidemics have been reversed, broad-based behavior change was central to that success. Yet despite this strong evidence, many have been skeptical about the effectiveness of behavioral HIV prevention programs. This concern is clearly misplaced, and we shouldn't confuse the difficulty in changing human behavior with the inability to do it.
I believe that the future for AIDS research indeed looks bright and promising. The history of AIDS research is one, quite frankly, of breathtaking accomplishments. However, here we are gathered in Mexico City, still in the middle of a raging pandemic. To be sure, there are multiple and daunting challenges ahead in how we confront HIV globally. Not all, but certainly some of these challenges can only be addressed through biomedical research.
Prevention, treatment, and care for children continue to lag behind adults. Support for affected children has been left largely to families, extended kin, and communities. Although they are the most appropriate groups to help children, they cannot protect and care for children without assistance.
ART Scale-Up is a health system success. It's the most ambitious public health undertaking of my lifetime, and it was something that was done against the conventional wisdom of the time.
People living with HIV have played roles and contributed immensely to healthcare systems. We are not just patients, we are not just receivers of services, but really we are the leaders when it comes to delivery as regards HIV and AIDS, because we have taught ourselves, we have taught our communities, we have raised our voices, we have helped people understand what's happening.
The lesson could not be more urgent. When the world denies women their most basic human rights, the world is vulnerable to HIV.
The key word emerging from this conference is combination. Combination prevention strategies tailored to decrease HIV transmission. Combination antiretroviral therapy to dramatically reduce morbidity and mortality among those infected worldwide. Combination antiretroviral therapy to also reduce community viral load as an aid to prevention. Combination strategies to enhance HIV testing. Combination strategies to reduce poverty, homelessness, and discrimination.
We now look forward to the final removal of HIV from the list of communicable diseases that ban visitors' entry to the US. It is an enormous victory for USA and international advocates.
Having more than 56,000 new HIV infections occurring each year in the United States is not acceptable, and we as a society need to think about what we all need to be doing at the individual level, in communities, and as a society to bring this epidemic to an end within our lifetimes.
We need a domestic AIDS response that is oriented around achieving clear and ambitious objectives in terms of reducing HIV infection rates, increasing access to care, and reducing racial and ethnic health disparities.
African Americans name AIDS as the #1 health problem in America, but only 1 in 2 say the United States is not losing ground. The other half say we are in the domestic AIDS epidemic. For Americans, this should be a wake-up call. Even as we keep working globally, we need to do much more to fight AIDS at home, and I intend to do so with my foundation.
We have pushed the agenda in Mexico, Latin America, and the world towards sex education, lower drug prices, and human rights. And we should not stop pushing. Goodbye to all. Adiós a todos. See you in Viena. Nos vemos en Viena. Muchas gracias a todos.